Hello everyone, I'm Dr. Anupama Gangwal, from Senior Consultant Obstetrician and Gynecologist at Cocoon Hospital, Jaipur, and I have special interests in aesthetic gynecology, and I've been working on lasers in gynecology for now 7 years. Menopause is another season in a woman's life. If you have not had a period for at least 12 months, that is the time when you are said to be menopausal. That is 12 months after the final menstrual bleeding. So menopause, sometimes no woman will have any symptoms. Sometimes there will be a number of women who will not have any symptoms. It's smooth sailing. Kab aaya menopause, pata nahi chala. And there are others who will have harsh symptoms like hot flashes, extreme vaginal dryness, frequency of micturition, lots of time they have to visit the washroom, and recurrent vaginal itching. Then they may be having some joint pains. Some may find very difficult to sleep, that is insomnia. These are some of the common symptoms. The condition of surgical menopause is when the periods are stopped by the process of surgery. This can happen on one way is when the uterus is removed for any reason, any condition that wants the uterus to be removed. So you remove the uterus and patient will have no more menses after that. The other condition is when the ovaries have to be removed. So normally if you remove the ovaries, there is no point in leaving the uterus. So removal of the uterus and the ovaries will cause cessation of menstrual cycles, and that is the surgical menopause. So menopause brings a woman almost equal. In certain conditions, the risk status of a woman and a man become equal. So when you are in your reproductive age group, the hormones that you have, estrogen and progesterone, they are protective to your heart. But when the menopause sets in, then your risk becomes equal to heart diseases, to osteoporosis. Osteoporosis is a condition in which the bone weakens. That is why women of menopausal age have a higher number of fractures. So osteoporosis, sarcopenia, that is muscle weakness, and fractures because of osteoporosis, and there is a condition called brain fog. That is, although this happens a little later, but the cognitive function of the brain tends to decline, and 100% we cannot say that this is just because of menopause. It is a part of general cellular aging also. When to see a doctor in your menopausal conditions? So I would suggest, once you are menopausal, you first and foremost you must confirm whether you are menopausal or this period has stopped for any other reason. So it is always wise to, whenever you have disturbed periods, delayed periods, or you haven't had period for a few months, you must go and visit a doctor, and she will do your gynecologist will do a general checkup. She will find out whether menopause has set in or whether there is some condition. The other reason is you find that I have no problem, my periods have gone. The other reason is screening. This is the time that you must visit your doctor because you are prone to certain conditions. So your breast screening, your cancer screenings, your cardiovascular screenings. So to say that I will pick and choose a time to visit a doctor is not the right thing. It is wise to keep on meeting your doctor after this sets in.